COVID-19 long-term effects. COVID-19 doesn't necessarily end when the test comes back negative. Many people continue to face symptoms long after recovering from the initial infection. This phenomenon, known as post-COVID syndrome, long COVID, or COVID-19 sequelae, affects up to 80% of people who have had the disease. What is post-COVID syndrome? Post-COVID syndrome occurs when a person continues to present symptoms for more than 4 weeks after the initial infection. These symptoms can persist for weeks, months, or in some cases even longer. Main symptoms: fatigue, 58% of cases, a feeling of extreme tiredness that doesn't improve with rest. Headache, 44%, persistent and sometimes debilitating headaches. Difficulty concentrating, 27%, also known as brain fog. Temporary hair loss, 25%, medically known as telogen effluvium. Difficulty breathing, 24%. Shortness of breath even during light activities. Loss of taste, 23%, and smell, 21%. Can persist for weeks or months. Other common symptoms include joint pain, 20%, muscle pain, 10%, sleep problems, anxiety and depression, palpitations, or tachycardia, dizziness when standing up, postural hypotension, digestive problems, nausea, diarrhea, intermittent fever, changes in blood pressure, ringing in the ears, skin rashes. Impact on organs. COVID-19 can affect various body systems, including respiratory system, can cause reduced lung capacity and even pulmonary fibrosis in severe cases. Cardiovascular system can lead to inflammation of the heart muscle, myocarditis, arrhythmias, and even heart failure. Nervous system can cause neurological problems, including increased risk of developing diseases such as Parkinson's and Alzheimer's in the future. Immune system. The body's exaggerated inflammatory response to the virus can lead to prolonged symptoms. Who is at higher risk? People over 50 years old. Those who had severe cases of COVID-19, especially those who required ICU admission. Individuals with pre-existing health problems such as heart disease, lung disease, hypertension, diabetes, or obesity. Women seem to report prolonged symptoms more frequently. However, it's crucial to understand that even young and previously healthy people can develop prolonged symptoms. What to do if you have persistent symptoms? See a doctor. They can assess your symptoms, order necessary tests, and develop a personalized treatment plan. Consult specialists. Cardiologist, if you feel chest pain, palpitations, or difficulties when exercising. Pulmonologist, to assess lung function, especially if you have persistent shortness of breath. Neurologist, if you have neurological symptoms such as persistent headaches or brain fog. Psychologist or psychiatrist, to help with mental health issues such as anxiety or depression. Rehabilitation. Some people may benefit from respiratory physiotherapy or occupational therapy. Be patient. Recovery can be slow, but many people improve over time. Take care of yourself. Maintain a healthy and balanced diet. Do light exercises under medical guidance. Prioritize sleep and rest. Practice stress reduction techniques such as meditation or yoga. Stay hydrated. Avoid alcohol and tobacco. Participate in support groups. Sharing experiences with others who are going through the same situation can be beneficial. Future perspectives. Research on COVID-19 sequelae is constantly evolving. Scientists and doctors are working to better understand the mechanisms behind these prolonged symptoms and develop more effective treatments. In some countries, such as the United States, there are already specialized post-COVID recovery clinics offering a multidisciplinary approach to treatment. Prevention. The best way to avoid COVID-19 sequelae is not to contract the virus. Continue following prevention measures recommended by health authorities, such as wearing a mask in indicated places, maintaining hand hygiene, and staying up to date with COVID-19 vaccines. Remember, if you are dealing with persistent symptoms after COVID-19, you are not alone. With proper care and patience, many people can significantly improve their quality of life.